I'm a specialist general practitioner, medical educator, supervisor, health leader and practice owner. I'm from the hills of Central West New South Wales and I have built my career in Western Australia. I have been the RACGP State Chair for the past 5 years and the Vice President of our college over the last 18 months. I understand the business of general practice and the everyday challenges GPs face. Funding reform, workforce pressure, AI, pharmacy prescribing expansion, and the rising complexity are affecting every GP and reshaping our profession. I understand how advocacy works, clear in public when our profession needs a voice, and persistent behind the scenes where trust, judgment, and discipline will shift decisions. If elected as your president, I will focus on the following priorities. General practice cannot rely on a funding model designed for another era. Modern GP care is more complex, more continuous, and more central to keep patients well and hospitals functioning well. When funding falls behind the real cost of delivering GP care, patients pay more, practices absorb more, and the care is delayed. It's time. I will lead the case for an independent pricing authority so MBS rebates for longer consultations and complex care are funded properly. I stand against capitation models that shift financial risk onto GPs and their practices. The relationship between a patient and their GP is the foundation of safe, high-quality care. I stand against pharmacy prescribing expansion that substitutes for specialist GP care, fragments the patient journey and undermines continuity. I support multidisciplinary care that's anchored and led by general practitioners. However, GP clinical autonomy needs to be maintained and multidisciplinary care needs to be funded appropriately. I will support general practice to reduce the friction to care, including chronic disease management, youth well-being and family safety through trusted, culturally safe local care. The brightest future for general practice is when we back every GP. We must make general practice a respected, rewarding and sustainable career for doctors. I will drive industry improvements to reduce the unpaid work, red tape and administrative burden that GPs face daily. I will champion stronger support and funding for GP supervisors and teaching practices. Rural and remote general practice must be a national priority. I will advocate for fair employment conditions, autonomy, improved incentives for procedural and after-hours care, stronger investment in supervision and practical infrastructure support such as housing. I will strengthen support for international medical graduates and doctors on alternative fellowship pathways. The RACGP must be the strongest voice for specialist GPs and general practice in Australia. We have strong advocacy, but we need sharper influence, earlier engagement with decision makers, stronger alliances, and better use of member stories and data. As your president, I will focus on our influence where GPs need it most. Funding reform, scope of practice, workforce planning, digital health, rural health, and practice sustainability. I will ensure RACGP directly challenges well-organised pharmacy lobby groups when commercial interests are put ahead of patient safety, continuity and the role of specialist GPs. Members are entitled to know their fees are being used wisely. I will scrutinise overheads and focus the college resources on work that strengthens GPs, practices, education, standards and advocacy. I will strengthen the support for supervisors and educators and expand professional development. Technology should support GPs and reduce administrative burden, not replace the expertise and the responsibility of specialist GPs. If elected as your president, I will listen. I will lead with compassion, be reflective of member opinion, and act with decisiveness and stand by you.